Here is exactly how the CMA Medical Assistant Certification exam works and how to pass it in just a few minutes. The credential is the CMA, awarded by the Certifying Board of the American Association of Medical Assistants, which is why you see it written CMA. AAMA, it is computer-based, multiple choice, at a test center. Note that the RMA, from American Medical Technologists, is a separate credential with its own exam. The format: 200 multiple-choice questions delivered in 4 40-minute segments. That is 160 minutes of actual testing time, with optional breaks between segments, 5 minutes, then 10, then 5, and the whole appointment capped at 3 hours. Now the part most study guides skip. Of those 200 questions, only 180 are scored. 20 are unscored pretest questions the board is trying out for future exams. They are scattered randomly, and you cannot tell which is which. So when a question feels bizarre, it may genuinely not count. Answer it and keep moving. The passing score is 405, and that is a scaled score, not a percentage. The scale runs from 200 to 800, anchored to a reference group of first-time candidates from accredited programs. So there is no clean number of correct answers to chase. Do not waste energy trying to compute one. Who can sit for it? The main route is graduating from a medical assisting program accredited by CAAHEP or a ABHES apply within 12 months of graduating, and you are Category 1. Longer ago than that is Category 2, which needs an official transcript. Renewing an existing CMA is Category 3. There is also an alternative pathway for cert other programs and apprenticeships. 2 more numbers. Once approved, you get a 90-day window to sit the exam and 6 attempts in any 12-month period with no required wait between them. After you pass, the credential is every 60 months. Now, what is actually tested, and the waiting here is the most useful thing in this video. 3 content areas. Clinical is 106 of the 180 scored questions, 59%. General is 38 questions, 21%. Administrative is 36 questions, 20%. Sit with that. Most people picture a medical assistant at the front desk, checking patients in, handling billing. But the whole front office side is only 20%. Split your time evenly across the 3 areas, and you have understudied where the points actually are. Inside clinical, patient intake and vital signs, safety and infection control, procedures and examinations, and pharmacology. General is legal and ethical issues plus communication. Administrative is billing, coding, and insurance, plus scheduling and health information management. 3 real questions. First, clinical. You have just removed your gloves after caring for a patient with C. diff diarrhea. What hand hygiene do you do? Soap and running water, not the alcohol rub. Alcohol does not kill C. diff spores, only friction and rinsing physically remove them. Second, general. A patient says clearly that he does not want a vaccination. The medical assistant says hold still, this will only take a second, and injects anyway. Which tort? Battery. Assault is the threat of unwanted contact. Battery is the contact itself. The needle went in. Third, administrative. A claim comes back from the clearinghouse because the member ID number has a typo. It never reached the payer system. Rejection or denial? Rejection. Nothing was ever decided, so there is nothing to appeal. You fix the number and resubmit. A denial is a claim the payer did adjudicate and refused to pay. That is the one you appeal. So how do you prepare? 4 habits. First, weight your study time to the blueprint. 59% clinical means vital signs, infection control, specimen collection, injections, and dosage math deserve the most hours, because that is where the most points are. Second, learn medical terminology as a system, not a word list. Roots, prefixes, suffixes, and the rules that join them. The exam loves near-miss pairs. A gram is the image, a graph is the instrument, and graphy is the process. Third, take full-length practice tests and keep a log of every miss with the reason you missed it. Then redrill only those. Untracked practice mostly repeats what you already know. The log is what turns practice into progress. Fourth, read every scenario question for scope. A huge share come down to one judgment. Is this mine to do, or do I report it to the provider? Interpreting a result, adjusting a dose, or giving anything without an order is outside your scope, and that one rule answers a surprising number of questions. So remember, 200 questions, 180 scored, 4 40-minute segments, 160 minutes, 405 to pass, a scaled score, not a percentage. 59% of it is clinical. And when a question asks what you should do, check your scope first. Start now with free medical assistant practice questions at .com/en/medical-assistant. English, Chinese, and Spanish with no sign-up.